Are your seizures getting in the way of a life you want to live? Well, maybe Dilantin or phenytoin is right for you. Dilantin is an anti-epileptic seizure drug. It's used to manage tonic-clonic and partial seizure activity. Dilantin's primary site of action is the motor cortex, where the spread of seizure activity is inhibited. Dilantin stabilizes hyperexcitability caused by excessive stimulation or environmental changes. Those with sinus bradycardia, sino-arterial block, second and third degree AV block, and patients with Adams-Stokes syndrome, and also hypersensitivity to Dilantin should not take Dilantin. Common side effects for Dilantin are headache, nausea, vomiting, constipation, dizziness, drowsiness, insomnia, and nervousness. Some adverse reactions to Dilantin include bradycardia, gingival hyperplasia, Peyronie's disease, rashes, and anaphylactic shock. Those taking Dilantin should monitor EKG and blood pressure regularly, observe for any signs of respiratory depression, and also check your Dilantin plasma levels. Dilantin can be taken orally or through IV. If taken intravenously, administration should not exceed 50 milligrams per minute in adults. A loading dose of 10 to 15 milligrams per kilogram should be administered slowly by the IV. Loading dose should be followed by maintenance doses of 100 milligrams orally or IV every 6 to 8 hours. While taking Dilantin, other anti-epileptic drugs should not be taken. Do not mix Dilantin with other medications if taken through IV. Take orally with food and do not drink alcohol while taking Dilantin. Nurses administering Dilantin should first obtain medical and any herbal history from the patient. Periodically check vital signs and report any abnormal readings to the primary doctor prior to administering Dilantin. During and after administering Dilantin, nurses should monitor blood pressure and check therapeutic levels in the blood. Hepatic and renal functions should also be monitored. Nurses should teach the patient to never abruptly stop taking Dilantin. Patients should purchase medical alert bracelets or medical ID cards if taking Dilantin. Nurses should also teach the patient to watch for hyperplasia and encourage routine dental care. Remember, when taking Dilantin, to always consume with food. And remember, Dilantin, helping you to have a brighter future today.